In this video, I'm going to be talking about what's worse for your eye, an acid burn or a bleach burn. So let's say you're working with some acidic materials, or if you're working with some more basic materials like Clorox or bleach or something like that typically, what's worse for your eyes? So let's go into the anatomy of what happens when you get both into your eyes. So let's say you're working with an acid, some type, let's say you're in a laboratory or working on some vehicle stuff and you get some kind of acid in your eyes, and no matter what kind of acid it is, okay? Acids typically have a lower pH than the human eyeball. So the average pH of the human eyeball is about 7 or so, and pH ranging on a scale of pretty much down to 0 or 1 all the way up to 14 basically. So pH determines how acidic or how basic a solution is. That depends on how corrosive it is and what it can do to something or someone. So going back to the acid, when you have a low pH, that can typically mean that, let's say you get an acid into the eyeball, goes into the cornea, it starts to try to chew away at the cornea, erode the epithelium, cause it to break down and disintegrate and different things like that. It's not going to get as far as you think it would. Here's the weird part behind that. With the human eye having a pH of 7 and an acid having a pH of, let's say, 3 or 4 or something like that, it's not going to get that deep into the eyeball because the eyeball is going to act as a barrier to prevent that acid from going deeper into someone's eye, causing issues, which is really weird to think about because you would think your gut reaction choice, which is worse, an acid or a basic solution, you probably pick acid because it usually corrodes a lot of stuff, and it does. But when it comes to organic tissue matter, like in the eyeball, the cornea, connective tissue, the conjunctiva, different things like that, it's not going to get that far with an acid. Now, what happens when a basic solution like Clorox or bleach or cleaning solutions or different things like that get into your eyes? So let's take some bleach that has like a pH of, let's say, 11 or something like that, or 12 or whatever the number is. The eyeball still has a pH of 7. So what happens when you introduce a basic harmful solution like bleach into the eyeball? You spill it, you're cleaning, and you actually spill some in your eyes. That's actually worse for your eyes because the pH of that basic solution is going to increase the pH of the eyeball. This is where it gets strange because now you have problems with the blood vessels do what's called like a blanching effect. They get too white and they're not functioning correctly, and you can actually have a lot of vision problems and issues if your blood vessels are blanched or bleached. That can cause a lot of vision problems that melts a lot of things away and can allow it to move deeper into the eye because that barrier is compromised. So when an acid jumps into the eyeball or gets spilled into the eye, it won't lower the pH of the eyeball because the pH throughout the human body, in the eye in this case, is going to resemble around 7 or so. Now, obviously, when you get into the stomach in different areas, that changes, obviously with stomach acid and different things like that. But when you throw a basic solution or spill a basic solution like Clorox or cleaning bleach or different things like that in your eyes, even laundry detergent for that matter, it can actually raise the pH of the eyeball, causing further issues for it to work its way deeper into the eye because that barrier is now compromised because it's matching the pH of the basic solution. So what do you do in either scenario? You need to see your local optometrist or ophthalmologist, get on some right prescription drops, maybe do a flush out, different things to clear the eyeball out of anything that could have saturated the entire area and temporarily have raised that pH. It's not getting the pH down that's the concern. It's making sure that the blood vessels are going to be working properly and you can actually have correct vision after things heal up and take their course. And when working with any of these kinds of solutions, you always need to make sure you're wearing some kind of safety eye protection that's rated for whatever solutions or environments you're working in to prevent any acids or bases getting in your eyes. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications and to learn more about your eyes. I'm Dr. Bryce Heffington. We'll see you next time.